All right, everybody, welcome. This is Dr. Tom Rafai here, internal medicine and lifestyle medicine, and past president of the National Board of Physician Nutrition Specialists, and past regional medical director for metabolic health and weight management for the Henry Ford Health System. And I am honored to bring back Dr. Barry Franklin, who was the director of preventive cardiology and cardiac rehabilitation at Corewell Health at the large William Beaumont Hospital, which is, if I'm not mistaken, Barry, I mean, I think it's actually larger than Mass General, isn't it? I mean, it's over 1,000 bed facility there.
You are correct. Yes.
It's and truth be told, I mean, Barry was someone who helped to train me. As a place that I trained my internal medicine residency, and actually, I was actually born at the hospital. And Barry is his bio is going to be in the description. The length, the number of publications that he has, his experience, American Heart Association, American College of Sports Medicine, it goes on and on and on. Believe me, the bona fides are there. What we want to get into with you, Barry, is really practical knowledge and what people can apply for their health when it comes to movement. Because we hear now there's exercise recommendations. That doesn't need to be in the gym, doesn't need to be out of the gym. What about when we're not in the gym and this whole sedentary death syndrome and sitting? And how can we get to practical nudges for a country that's probably, thousands of steps away from now where we may be settling in on where mortality risk reduction is, maxed out. And sorry, it's not 10,000 steps, everybody. That was a great marketing tool. Maybe Barry can tell us a little of the origins of that. But just to start out, I actually just want to ask something prior to that. And that is, honestly, what drove you to be interested in physiology and really preventive cardiology? Was there something in the beginning of your career, something that triggered your interest?
Yeah, Tom, I was an undergraduate at Kent State University. I came across two fabulous professors, Larry Golding and Paul Ribisel. And I was a gymnast in college, so I was interested in physical activity. But then I had Golding's course in exercise physiology, and I said, wow, this relates to health and well-being. And then they started bringing me in the lab. They said, you want to get dunked underwater and find out what your body density is? And have you ever had a VO2? No, I never had a VO2 max. And all of a sudden, I got really, really interested in the medical implications of exercise science, exercise physiology. And from there, then decided to go on to Michigan and then went on to Penn State for a PhD. So it really all started at Kent State gymnastics team and being involved in the exercise physiology lab as a subject.
Wow, that is fantastic. It's good to know that history.
Yeah.
And when it comes down to getting right into the practicalities of the matter and starting from the big down to the maybe more granular, would you say that we are starting to learn, at least it's my impression, you could tell me whether I'm wrong, that more and more that every little bit counts? We used to go to, it has to be, for instance, 30 minutes for this amount of time, and that's great. Absolutely no problem. And for full disclosure, I'm a gym rat. I like to go and do continuous levels of physical activity. But for the people out there that are just trying to find where they can fit in physical activity, and do I have to go and do a continuous hour or even 30 minutes at a time? Is there not evidence building that physical activity can accumulate even in small bits throughout the day, what some people are calling exercise snacks or movement snacks or whatever the new term du jour is?
Yeah, Tom, I agree with you 100%. Really, both structured exercise and lifestyle activities combine. So when I talk about physical activity and health today, it's a marathon. It's not a sprint. It's over a long period of time. Yes, we can look and say, well, if I go out and run 35 minutes a day, 5-6 days a week, yes, that's structured exercise, and that's going to reduce your mortality by about 40-45%. Walking, you got to do a longer period of time, sometimes 2 to 3 times. 2 to 3 times that 35 minutes is 105 minutes of walking, Tom. Most days of the week will reduce your mortality by about 30%. Those are structured, but the point I want to make is this. We've learned a lot from recent studies over the last decade that have looked at a technique called accelerometry, where they actually look at how much movement every minute of the day. And two major findings that I think are relevant to your listeners. Number one, the magnitude of the association between physical activity and good health is larger than we previously thought. I used to say fitness is more important than physical activity. Now, the latest study suggests physical activity and fitness are both almost equal in terms of their impact on longevity. And secondly, a good friend and colleague, you know the name, Dr. Aymin Lee from Harvard, who's done a lot of these studies, said, and I'm quoting her, "We have learned that no dose of physical activity is too small to be healthful." So that really highlights exactly what you're saying. It's the total amount. It's not just a structured exercise program.
So I think then the one big message we can get out right from this first chapter, let's say we're doing, Star Wars, Empire Strikes Back, Return of the Jedi, is that whatever it is that gets you moving beyond let's say you're at the typical American average, and I guess it depends on what you read, maybe it's 5,000 steps a day, anything you can find to nudge you to movement, whether it is in the gym, out of the gym, whether it's a parking further trick, whether it is I'm going to now just walk over to so-and-so's desk that is a 30 yards away rather than shooting emails, whatever the case may be, all of it adds up because that physical activity we're talking about now is not just the moderate to more brisk or intense exercise, but even the light activity that can accumulate throughout the day.
You're exactly right.
Okay.
Exactly right.
All
In
right.
fact, I oftentimes cite a study that says if you just get up and move for 2 to 3 minutes every hour, just 2 to 3 minutes every hour, there's a significant additional mortality benefit associated with that, or survival benefit associated with it. So every bit counts. You're exactly right.
So keeping this down to the really brass tacks, that just getting down to the pith of it. We mentioned something a little bit earlier. In terms of those that are looking at, okay, I've got my Fitbit, I just use now my unfortunately, for better or worse, my iPhone is stuck to me. It's got a great pedometer built into it, and they're looking at accumulating steps. Let's help differentiate the marketing of the 10,000 steps per day versus where we're seeing this, and maybe it's not that far off, but the science on mortality plateau, and that doesn't mean quality of life. We're just talking about mortality. Dead, not dead. Okay, fair enough. But it doesn't necessarily require, at least what we've seen, 10,000 steps to hit the mortality plateau. Is that fair, at least where we're at in terms of the evidence?
Yes, I would agree with you. For many years, we said 10,000 steps, which is roughly walking 5 miles if you're at a normal step length and so on and so forth, 5 miles a day. More recent studies, the most recent study that I've seen is in Lancet, a pretty darn good journal, which looked at over 47,000 individuals, and they came up with a couple things. Number one, you start getting benefits of steps. It's not just 10,000. If you're doing 2,500 to 3,000 steps, you're starting to get some benefits. So it's not like you got to do 10,000. You're getting additional benefits. Some people say 3,500, but 25 to 3,500. Then the other point that I would make is we oftentimes say 10,000, but this research study suggested this. If you're under 60, yes, the goal would be 8 to 10,000 steps. If you're over 60, that benefit where the leveling off occurs is 6 to 8,000 steps. So roughly somewhere in the neighborhood of around 7,000 steps. The other point that I oftentimes tell our patients is that when they ask me how many steps, I tell them based on the recent Cardia study, over 7,000. The Cardia study, over 2,000 individuals, black, white, men, women. What did they find? Over a long period of time, long follow-up, they found that if you're taking over 7,000 steps a day, as opposed to fewer than 7,000 steps a day, you had a 50 to 70% reduction in mortality. That's huge. And that's less than the 10,000 steps. So take home message, if you're doing nothing, do something. Even if you get 3,000, 3,500 steps. If you want additional benefits, continue based on age to some extent. You certainly don't have to do more than 10,000. And this recent study suggested 8 to 10,000 if you're under 60. And if you're over 60, 6 to 8,000. So that's kind of where we're at with it.
So what is the pacing? I mean, is it somewhere around? I mean, it depends on someone's obviously stride length, this, that, and the other thing. But if I'm just going to throw out a number and let's say give or take, if someone's walking with some degree of intention, maybe not necessarily sweating, 80 to 110 steps per minute. If someone's walking for a purpose, what would be about if someone's going to say, okay, per minute, I've got 5 minutes. How many steps can I get in 5 minutes? Um, is that about right? I mean, if
Yeah,
for me it is.
well, it's going to depend on length. It's going to, and there are some studies to suggest that if you're stepping fat at a faster rate, you may get some additional survival benefits. But it's really hard to put a specific number.
But go and time yourself so you could see. But you will be surprised how much you can get in these little bouts, as Dr. Franklin's just mentioned, even just a couple minutes. I know, we're not necessarily talking to everybody that might have, but some may have diabetes. Now, the American Diabetes Association is encouraging at least 5 minutes of physical activity for every 30 minutes of sitting. But they even put in, if I remember reading the guidelines, look, even kicking your legs under the desk, they're just do anything to move because of insulin sensitivity and better blood sugar control in terms of timing, which brings me to my next question, which is, this issue of distribution. I can't forget, and who was it from the uh, Baton Rouge, down in Baton Rouge, the
Pennington?
Pennington
Yep.
lab, what was talking about the term was exercising couch potato, that many people are exercising, but many of those people that are exercising, many of them will then be stuck at a desk the rest of the day. And what amount of exercise would you need to do to mitigate that? And that's the cardiovascular. And let's not forget about the musculoskeletal and the hip the hip flexors locking up and the posture issues and all of that. That's a whole maybe separate discussion. But what about the distribution of physical activity? I mean, can you get away with sitting 8 to 10 hours pretty much continuously throughout the day without the little bits of movement snacks just because you exercise for 30 or 45 minutes in the morning?
You and I have similar questions from similar patients. And I had a patient the other day who said, if I get the 150 to 300 minutes in per week, do I still have to do much more? And I said, what do you do? He said, I'm on a computer all day, and at night I'm at a computer. And my answer was, well, I give you credit for meeting the national guidelines of 150 to 300. But the fact of the matter is, and listen carefully, sedentary habits combat or counteract exercise benefits. And the most recent guidelines have shown independently the linked sedentary behaviors, computer, television, with increased mortality and increased cardiovascular events. So I would probably say, I'm not worried so much about your structured. You're already in that structured. If you can get away from that desk or the computer, or even at 2-3 minute breaks, 4 minute breaks every hour, you're going to add additional healthful benefits of physical activity, even though it may not qualify as moderate to vigorous physical activity.
This is such a nutrient dense conversation. I love it. Now let's even now delve into, probably you can imagine, where I'd want to go into next is we've been talking a lot about essentially the cardiovascular, some people might call it the aerobic fitness end of it. We've expanded into, hey, every little bit counts. Great, moderate to higher, more brisk levels of physical activity, but even the light activity you break up throughout the day, great. But particularly as we're getting older, that ode to where are we at with the power of resistance training, that complementing the aerobic end of it, that we want to make sure, whether it's for bone health, but even for other aspects of health. We're now seeing resistance training. Let's already give credit to aerobic, but possibly in terms of even dementia risk reduction, blood pressure control, that it has its role too. So where do we fit that resistance training in it? And as well, maybe a note to Jack LaLanne. You don't need a gym. I mean, you remember, just do anything. Let's give a little ode to Jack. Resistance training in whatever way, shape, or form.
I think Tom, as people get over the age of 60 and certainly over the age of 70, resistance training, or the time spent for resistance training, becomes more and more important. Because as I walk into these assisted living and homes like that, the critical question is, do they have the aerobic? The aerobic capacity is not the critical question. The critical question is, Tom, can they get in and out of a car? Can they get off a chair? Can they get off a toilet seat? These are activities of daily living. So strength probably is more important, or at least equally as important as aerobic training. Most people with a 3 Met capacity can do pretty much activities of daily living, but do they have adequate strength?
Can you
Couple other
define that
points.
3 Mets? You have done it well before, and I know what you're talking about, but for the audience, give us a practical translation of 3 Mets.
Yeah, practical translation of 3 Mets means you're increasing your energy expenditure 3 times above rest. An example is walking at 3 miles an hour, 0% grade is 3.3 Mets, which, by the way, is a very good training workload for older individuals. Because if you're routinely exercising above 3, I know if I put you on a treadmill and do a maximal treadmill test, you're going to be above 5. 5 is the cutoff. Above 5, much better prognosis. Below 5, not so good a prognosis. And if you say to me, Barry, I can't walk, 3 miles an hour is too darn fast. 2 miles an hour, Tom, 3.5% grade will also get you to 3.4. So the ideal intensities for older adults are at least training above 3 Mets, which can be gotten by 3 miles an hour, 0% grade, or 2 miles an hour, 3.5% grade. That's an important distinction. To get back to the resistance training, in addition, and I think this is critically important, resistance training provides independent and additive benefits to aerobic training. So if you say, Barry, compare and contrast, number one, resistance training is as good or better for improving muscle strength, muscle endurance, muscle mass or hypertrophy, increasing bone density, increasing basal metabolic rate, and in glucose metabolism. It's as good or better. Secondly, by increasing muscle strength, you decrease the heart rate and blood pressure when lifting any given load. So if you're carrying suitcases or groceries, if you're stronger in the arms, your heart rate and blood pressure aren't going to be as high. Last point that I'd make is that we have good studies to suggest as strength increases, survival increases. We have even better studies to indicate as fitness increases or physical activity increases, survival increases. The last point that I would make is we measure fitness in terms of Mets. So if I put you on a treadmill and we see what, after an exercise training program, let's say you've improved by 1 Met. 1 Met corresponds to about a 15 to 17% reduction in mortality. Well, you may say to me, well, that's not all that huge. It's as good as you're going to get when you prescribe aspirin, statins, beta blockers, or ACE inhibitors. That's about 20%. Probably the best article, by the way, you were kind enough to send it to me before I even saw it, was the one by Pollock, P-A-L-U-C-H, University of Massachusetts, Circulation 2024, where we look at the role that resistance training plays in complementing aerobic training. So that's just out.
Yeah. And you brought up something that just reminded me of some of the great research that you had done in the past when you mentioned how strength training can reduce the blood pressure response to when you're lifting something heavy. And of course, I think first snow of the year, going out there and shoveling that snow. You've seen it. The people pop into that ER. They've been sitting maybe watching football all season, not being too active, and then they go out and start heaving these heavy loads of snow. Blood pressure rises, pops that plaque, that atheroma like a pimple. And so are what you saying to make it practical by staying physically fit, including that resistance training? Not that I would recommend doing 10 to 20 pound heaves at a time. Maybe you want to take 5 pound heaves at a time, but and maybe give us some detail on safer snow shoveling, and keep it in mind for next winter. That's almost a practical translation of what you're talking about. When you go out and do something like that, first know that you'll be protected against potentially having a massive cardiac event.
Yeah, our studies years ago published in JAMA, where we took 10 healthy young guys did treadmill tests. So we measured their fitness. Then we had them go out and shovel heavy, wet snow. We found that the higher fitness individuals, when they were shoveling snow, had lower heart rates and blood pressures when they were shoveling snow. So those who did the best on the treadmill testing had the lowest heart rate and blood pressure responses. It's dangerous, however, due to the fact that the vast majority of Americans over 50, as you well know, have hidden or latent coronary artery disease. Studies from the Cleveland Clinic and a recent study in Sweden said if you're over the age of 50 and you grew up on Ben and Jerry's and Kentucky Fried Chicken and automatic garage door, you've got underlying heart disease. The classic examples, of course, are the late newscaster Tim Russert, who died of a massive MI, James Gandolfini, both these guys in their 50s who said, oh, we don't have heart disease. I think the other point that I would make is that, I like resistance training, snow shoveling for sedentary people with underlying heart disease is, as George Clooney would say, the perfect storm. What happens is you've got isometric exercise, you've got Valsalva or breath holding, you've got arm work, you've got cold temperatures, which constrict blood vessels, raise blood pressure, constrict those coronary arteries, which you and I know are about the size of cooked spaghetti. And lastly, you're largely standing still. When you're walking on a treadmill, Tom, you're promoting venous return. You're getting blood back to the head, to the heart. When you're shoveling that heavy, wet snow and legs are largely stationary, blood's not getting back to the heart, to the head, causing ischemia, insufficient blood and oxygen flow to that heart, which, as you well know, can be highly arrhythmogenic, can lead to ventricular tachycardia and other life-threatening heart rhythm irregularities. So in general, I tell patients resistance training is good, but going out and shoveling heavy, wet snow, if you're sedentary or you've got a history of heart disease or you've got risk factors for heart disease, can be very, very dangerous.
Fantastic. I mean, this has been great, and I think to round this out, the practical question, it wouldn't be fair unless I stated so what I do myself. I think what I've seen, another practical aspect of the data is that the best physical activity is what you'll be willing to stick with. That as great as something might be, if it's just going to be a month, then that's it. I tend to, as you know, I love resistance training, but I've realized that as much as I might love it, I still need that aerobic. So I've decided to go in a route of higher reps, and then I almost never sit between sets. I'll either be walking on the gym or I'll get on the treadmill for a minute. And I've tried to build this what I call resistance aerobic ish type or flexio type of training. What is it that Barry does to engage in that's practice? And I only get about 9,000 steps a day. I've been tracking myself, but I'm like, you know what? I break it up throughout the day. I accumulate about 4,000 in exercise. I spread the rest out. I've got my resistance. Maybe we'll touch a little bit on flexibility as a final moment. But what does Barry do to make sure that he's practicing what he preaches?
I focus, I do some light resistance training. I may do some modified push-ups and things along those lines, but I use a treadmill. I actually follow the Bruce protocol. Instead of 3-minute stages, I have 5 or 6-minute stages. I start with 1.7 miles an hour, 5% grade for 6 minutes, and then 1.7, 10% grade for 6 minutes, and then 2.5 miles an hour, 12% grade, which by the way is 7 METs for about 6 minutes. And then we'll finish with 3.2, 3.3 at 14% grade, which, as you well know, is about 9 to 10 METs.
Yes.
And that for 70, I'll be 76 in a couple months, 9 to 10 METs for the upper training level works out pretty good. And my echo a couple of weeks ago showed an EF of 65%. So I felt fairly good about that.
Fantastic. So you see, what we're trying to tell you people is that we do what we love and will stick with. And you've been doing that for, for how long? I mean, this is not new to you. This is a routine that you have kept up for quite some time. Am I right?
Yeah, for many, many years. And I do believe there are time advantages by doing something a little more rigorous, like 3, 5, 7, 9 METs, as opposed to, I don't have the hour or hour and a half or 105 minutes. So I would rather try to get it in 20 to 30 minutes, say 3-4 days a week, something along those lines. Yeah.
Right. Yeah. And I will admittedly, I don't know how much longer my knees or hips will handle it, but I will occasionally find myself sprinting actually pretty often, a couple times a week. So great. We both do what we're talking about. We're not some freaky. I mean, I love Jack LaLanne. Don't get me wrong, but that whole 70 years old pulling 70 boats in the San Francisco Bay, not necessary. And I think he even said that. I'm just trying to show people what you can do, but by no means do you need to do what I'm doing to be in shape.
No, and I agree with your point. I want to get back to your point that in between sets, instead of standing around, you're walking around, you're moving, you're doing some things. Every minute counts. So yes, if you can get some additional activity in that period of time. There was an old adage that said exercise bouts have to be 10 minutes or longer. That was the original JAMA paper in the 90s. Now we know the take-home message is every minute counts. So you want to finish a set rather than standing still, you'll walk, you'll do some stretching, whatever it takes. All that stuff can maximize the potential, the physiologic and clinical potential of your workout. So I like that practice.
So
It makes good sense.
fantastic. And I think just for the last note, we mentioned it, you mentioned it even right there, because we talk about strength, we talk about aerobic, you got to just at least give a little ode to flexibility because, as we get older, I think it's something that I have to admit during the pandemic, I gave that up. The gyms weren't open. So I'm like, I'm going to walk and I'll do pull-ups, and I paid a price. I paid a real price. I didn't really think it would be as much of a price as it was, but your final thoughts on where the role of flexibility.
Yeah, I'm totally in agreement with you. I think it becomes more and more important as you get over 40 and 50 and 60 and so on and so forth. That flexibility training really increases your ability, your agility, your balance. And we typically recommend it at the end of a workout when somebody's done with the aerobics and they're walking and cooling down. We'll generally do a 5-8 minute stretching bout at the end of the exercise training session. For the aerobic session, in my opinion, the best warm up is that activity only at a lower intensity. So if you say to me, Barry, I jog at a 4.5 mile slow pace, my answer is finish on the treadmill at 3.5 miles an hour within 10-15 beats of your training heart rate, and that's a good warm-up.
Exactly, because from what I've read, and I think it's pretty solid now, talking to the physical therapist, static stretching a cold muscle is not necessarily the best idea.
No, I think most of the time it's done after the exercise session. And we also know, once again, that if your training heart rate, let's say, is 120 beats a minute, in my humble opinion, you want to finish your warm-up at 105, 110. You don't want to do 5 stretches and go from 70 to 75 and then jump on the track and try to get to 120. Physiologically, that doesn't make sense. Our James Barnard, UCLA Medical Center, showed years ago, sudden strenuous exertion can cause myocardial ischemia, ST segment depression, which can be highly arrhythmogenic. So your warm-up, you want to finish the warm-up 10, 15, 20 beats below your target aerobic training level. So if it's 120, you don't want to finish your warm-up at 75. You want to finish your warm-up at 105, 110, something like that. That's physiologically the best.
This was the best. Thank you for this wonderful. I mean, we rounded, I think, everything out. Anything practical you needed to know. I hope that those of you that have gotten started and are just starting to really a streak and you want to keep the momentum going, I hope this motivated you. If it is something that you're thinking about, I hope that we've given you the confidence that every little bit counts. And if you're over and above all of this and it's something that you just want to help motivate someone you love, then send this video out. Obviously, we'd love you to click like, click that subscribe button, and look up GPS for Success, Dr. Barry Franklin's book, which is a fantastic read. And you'll see his bio and some of the link information below. Thank you so much, Dr. Barry Franklin. It's always a pleasure and honor to speak with you. I always learn something new.
Tom, thanks again for your time. Appreciate the opportunity.